Hi, if you're new here, my name is Bodh. I'm currently a third year medical student in Japan, and today I'd like to talk about, the challenges as an international student studying medicine in Japan in Japanese. So I have a big exam this year, this December actually. That exam is fully in Japanese, of course. So that exam in Japanese is called Igaku Kyoyo Shiken, I think. We just call it CBT, and CBT stands for computer-based testing. So you have questions, they're multiple choice, and you answer them on a computer. Now, as an international student studying medicine, there's two things that is difficult. First of all, medicine by itself is difficult. The Japanese language by itself is difficult. And when you put those two together, at least as an international student, it's very challenging. But I also find it quite fun because it's challenging. So to give you some context about my situation, before I came to Japan, or before I entered medical school, I received 6 months of Japanese training. Not medical Japanese, like normal Japanese, because I had zero Japanese. In my school, the first 2 years will be taught in English, which is okay for me. From third year, which is the year I'm in right now, onwards, until I graduate, it's all Japanese. So obviously, 6 months of Japanese training is not enough. So that's why we continue to study Japanese in our first and second year. So we would have our medical lectures full day in English, and then in the evening, we'd study Japanese for an hour or so. Depends on the schedule. Now I'm in third year. I'd say at the beginning of third year, my level of Japanese is somewhere in the upper N3 and lower N2. I'm not the best in my class, like that's for sure. So now I enter third year. I entered in April. Now, at that moment, April of this year, my medical Japanese knowledge was very minimal. I didn't focus on it too much. I was too focused on the English exams. I was too focused on the normal medical exams in English. So I haven't really started looking into medical Japanese that much. I haven't really been reading the books or watching the videos. So the first month, from April to May, was the most difficult. I started watching videos, Q-Assist, and I started reading books, the review book, the Byoki ga Mieru books. And in that first month, I had to look up the dictionary for almost every single word. Like it took me like half an hour to just read one page. But I didn't bother making flashcards because I thought that the words would repeat so many times that I don't even need to make flashcards. As long as I keep reading and I keep on checking the dictionary, sooner or later I'll start to memorize the words. And that's kind of what happened after a month. The words started to repeat, but I had to study really hard. I had to go through the question bank like as fast as I can so I can see all the words. And the funny thing and the nice thing about the Japanese language is that the medical terminologies are generally either written in kanji or they're in katakana if they're borrowed from English or Latin. And for kanji, sometimes I cannot pronounce the word, but I know the meaning of the word because of the kanji. So that's cool. So I want to show you some CBT questions so that you can get an idea of the level of Japanese you need to solve these problems. So the start here, リソゾームの特徴として挙げているのはどれか? So, rhizosome, it's similar to lysosome. Rhizosomeの特徴 is characteristic として挙げているのはどれか? 挙げている means what is wrong, like the mistake. So A, 内腔は塩基性である. So this is saying 内腔, 内 here, see like 内 means inside. 腔 means like space. So like inside cavity は塩基性. So that just means basic or alkaline. So that's wrong. The cavity inside the cavity of the lysosome should be acidic. Here, that's the answer. Yeah, should be A. Should be acidic. B is like 小胞を細胞外に I think that's 放出する. 小胞, see, 小 means small, and 胞 here means like, I don't know, like a bubble or something. So 小胞 means vesicles. See, like sometimes like sometimes even if you can't pronounce it, you can tell what it means. を細胞外, so like 細胞 is cell, 外 is outside, 細胞外に放出する. 放出 is like out, like release. 自己誘拐を引き起こす. 自己 is like auto. 誘拐 is like lysis, or autolysis. I think that's what it means. I could be wrong. Yeah, let's look at another question. 小腸上皮細胞の So 小腸 is small intestine. Then 上皮 is like epithelium. 上皮細胞 epithelial cell. No, I kind of forgot how to read this, but I know it means villi. I think it's bijumo, maybe. It means villi. の形成に必要なのはどれか? So now here, these are all katakana. So if I read it to you, you might understand, because it's borrowed from English. For example, A, actin filamento, actin filament. B, myosin, myosin. C, tubulin, that they make microtubules. D, keratin filamento, E, ramin. So the question is, what is necessary to make the villi of the small intestine's epithelium? So the correct answer would be actin filament, actin filamento. So answer should be A. Yeah. Now, 解凍系を促進する働き I guess が最も大きいのはどれか? 解凍系 Kai means like break. To is sugar. K is like system. So break sugar system is glycolysis. O sokushin. This is like advance. So 働きが最も大きいのは. So this means big. 大きい. So like what factor induces glycolysis to happen more? Yeah, that's what it means. So acetyl-CoA, see acetyl-CoA, ADP, ATP, G-acylglycerol. So this is diacyl glycerol. Now this one's a weird one. Pyruvinsan. Pyruvinsan is pyruvate, I believe. Pyruvate. Answer should be ADP. B. This one, 100 meter, 100 meters, of course. I don't know how you read that on its own, but that means running. を全力で走ったとき、主に消費されるエネルギー源はどれか? So, when you run 100 meters and while you're running, mainly what is used as energy? So, A, aminosan, amino acid. B, creatinrinsan, creatine phosphate, I guess. C, shibosan, fatty acid. D, musan, lactic acid. E, pyruvinsan, pyruvate. It should be B, creatine phosphate. This is cardiology. So this just says, tadashi no wa doreka? What is the correct thing? So what is the correct thing about this ECG? And if you look at this ECG, you will see that the PR interval is elongated, and then suddenly the QRS disappears. So this is AV block, second degree AV block, Wenck back. So let's look at A. 急性心筋梗塞である. So A, it's saying it's acute myocardial infarction. This is not AMI, not acute myocardial infarction. B, 同結節に電動延長が見られる. 同結節 is sinus node. So it's saying like the sinus node pathway is elongated. It's an AV block, so it's not that. C, 高不整脈薬を使用する. 高不整脈薬 is anti-arrhythmic drugs. D, 外来の経過観察で対応可能である. This means that 外来 is like outpatient care. No, 経過観察 that's like observe. So you don't need to treat it, you can just observe. で対応可能である. So D is correct because for this AV second degree AV block, Wenck back, it's not life threatening and you don't really need to do anything. You can just observe until something else happens. 若年者にはペースメーカー something 込み手術を行う. So you don't need a pacemaker. Pacemaker is needed in a complete AV block. Or in Mobitz type 2 as well, I kind of forgot. Yeah, it should be D. This is CT. So, 胸腹部造影 CT 画像を次に示す. So it's just saying, this is abdominal CT shown here. 以下の画像を呈する疾患の合併症として見られないのはどれか. So it's saying, according to this CT, it's a disease, right? And in that disease can cause complications. 合併症 is complications. として見られない. So what complications will you not see in this disease? So if you look here, this is, I think it's 下行大動脈, so descending artery, aorta. And this should be the ascending aorta. And you see there's a dissection here. So this is a typical CT of aortic dissection. And you have your complications here. This is kashi kyoketsu. Kashi is lower limb. Kyoketsu is ischemia. No kosoku is cerebral infarction, stroke. Shin tamponade is cardiac tamponade. Shinkin kosoku is AMI, and soboben heisa fuzen sho is mitral stenosis. So aortic dissection could cause everything except the soboben heisa fuzen sho, except mitral stenosis. Yeah. If there was aortic dissection, it should cause aortic regurgitation. Sorry, this is not stenosis. Soboben heisa fuzen sho is it cannot close. See, heisa means close, fuzen means failure. So failure to close would mean regurgitation. So yeah, it should be aortic regurgitation, not mitral regurgitation. Here's a bigger case. 70歳の女性 70-year-old female 側頭部の頭痛を出走に来院した. 側頭部 is temporal side, no 頭痛, so headache, so temporal headache. 出走に来院した. 出走 is chief complaint, 来院 is go to hospital, like go into the hospital. 頭痛はたびたび I don't know what たびたび means. ひっこり肩側性である. 肩側 sorry. So 肩側 means unilateral. 悪心と応答はない。悪心 like nausea and auto vomiting ない。So no vomiting, no nausea. 数ヶ月前から全身倦怠感を感じており So a couple months ago he had like I don't know how you call 全身倦怠感 like malaise I guess like malaise fatigue you don't feel well basically 食欲はなくなり So 食欲 is appetite 食 means eat 欲 means want so eat want is like want to eat is appetite so appetite はなくなり体重 this 体 means body 重 means weight or heavy I guess so 体重 is your body weight も減少してきた so decrease 体温 体 again body 温 is temperature body temperature 37.5 G 血圧 血 is blood 圧 is pressure blood pressure 148 over 110 then I forgot how you read that but that means superficial so the superficial temporal artery に高血 I guess that means it's hard that means touching palpate 動脈の生検組織のHステインを示す So it's shown here it's a typical presentation of GCA giant cell arteritis So この疾患について正しいのはどれか正しい is what's the correct A 加齢性疾患である So it's saying that this disease depends on your age which is kind of true but I guess not B 視力障害は伴わない So 視力 means your vision 障害 is like blockage to your vision は伴わない So it's saying that problems with your vision isn't related GCA affects your vision So B is wrong C 組織中に多核鏡細胞が出現する組織中 or 組織中 I guess it means in the histology you see a lot of I think that's called giant cells I guess 出現する so C should be correct because it is GCA here's one on pediatrics So Nichi is day 0 So day 0 no Shinseiji Shinseiji is neonate I believe So 在番39週 So that's the mother he was before he was born he was 39 weeks old His weight is 2,650 grams that's normal で出生した So he was born at 39 weeks and 2,600 grams生後18時間から皮膚と So after he was born 18 hours after he was born his skin 皮膚と眼球結膜 his conjunctiva の横断を横断 is that's not 横断 that's 汚染 it's yellow basically it's jaundice basically を認めていた they saw診察として最も考えられるのはどれか So what's your diagnosis? Most likely diagnosis A 生理的横断 Physiological jaundice B 母乳性横断 So jaundice caused by the mother's milk C 母子間血液型不適合 It's like blood incompatibility between the child and the mother it's like RH negative RH positive like those things D 先天性胆道閉鎖症 So 先天性 is hereditary tongue is like the bile but like no it's not bile it's like stuff that relates like the gallbladder and the look tando just means the bile duct 閉鎖 is close, sho is disease. So hereditary biliary atresia, I guess. E is shinseji kang-en. Shinseji neonate, kang-en is hepatitis. Kang is liver, N is inflammation, so hepatitis. So, I didn't put the answer, but the answer should be C. And the reason being is the timing, because this jaundice occurred in less than 24 hours after he was born. He or she was born. So it's not physiological and it's not these other diseases. It should be like RH or ABO incompatibility. Okay. And there's also these type of questions where they give you a case and then they give you a bajillion answers to pick from so that you can't really cheat using probability. So this case, Goju Gosai no Jose, 55-year-old woman, Kangsetsu, so joint pain, shuso ni rain shita, rain in hospital. 1年前から 1 year ago, 関節 joint の痛み is pain を感じていたという It's just grammar. Doesn't matter. 最近特に NEC 関節の手指第2、3、4、4 whatever. Important thing is N means distal and E means distal, and she setsu setsu, it's the joint in your, this is referring to DIP, the distal interphalangeal joint. So this the end of your finger, the last joint here. It occurs on fingers 2, 3, and 4, which I'm guessing is these fingers. On DIP, there's shucho, that's like a bump, and atsu, that's like pain basically. Kanjiru. And it's saying the chu teyubi kansetsu setsu? Maybe it's wrong. Ni shucho to atsu o mitomenai. So the chu, I don't think that, I kind of forgot what that joint refers to. Chu, is that the MP joint? Or I'm not sure if it's metacarpophalangeal or if it's proximal. Could be metacarpophalangeal, but the most important thing here is that she's a 55-year-old patient, is a 55-year-old female, has joint pain and DIP. Since it's joint pain and DIP, you can just rule out rheumatoid arthritis because that doesn't occur in DIP. And like the most common thing should be the so let's read it. A, Bechet bio, so Bechet disease. That's not that. Kyo chokse seki en, so that's, I think, ankylosing spondylitis. This one, sarcoidosis. This is something harada bio, so it's the disease that can cause uveitis. Henkei se kansensho. So this is the correct answer. I kind of forgot what it's called in English. Oh, osteoarthritis. Yeah, that's the correct answer. Yeah. Let's read the others. Sheguren shokugun. So Sheguren is how they call it in Japanese. Shokogun means Shokogun is syndrome. Kyohi sho, that's scleroderma. Kanose kan setsu en. Kano is like, I guess, suppurative arthritis, I guess. Tsufu, that's gout. Paget disease. Tahatse king en. Tahatsu means a lot. King means muscle. En means inflammation. So a lot muscle inflammation. Polymyositis. Zenjuji jintai songsho. So Zenjuji jintai is ACL, anterior cruciate ligament in your knee. Songsho means damage. 고주지 진타이 성쇼. That's PCL, posterior. 항getsu 항 성쇼. It's the disc in your it's in your knee. Hifu king and hifu is skin, king again muscle and inflammation, so I guess dermatomyositis. Yeah. King nikshu is kotsu nikshu. Here. Kotsu nikshu is osteosarcoma. Zen shinsei erythemato desu. It's basically SLE. Compartimento shokogun, so compartment syndrome. Yeah. I hope this video shows you at least the level of Japanese you need. And yeah, maybe you can become proficient in N2 or even N1 level Japanese, but that doesn't mean you can read medical Japanese. It's kind of a different thing. It's also like in English, right? Or like normal people who don't learn medicine won't understand medical terminologies in English, and same goes with Japanese. So it's kind of like an extra step. And I hope this is somewhat relatable to other international students that study abroad and is challenged with not only what they're studying but also the language. And it's okay. I mean, like, it's difficult, but that makes your life more interesting, I think challenging yourself just makes your life a lot more interesting. And I always think, like, as long as you're studying, you will always improve, like, no matter what you do. As long as you sit down and do it, even if you can't read it, just check the dictionary. As long as you keep doing it, you'll be fine. Okay. Good luck.